Hi, my name is Deborah Jones, representing the We Are Concerned organization. We Are Concerned has designed a new program that will be centered around nursing home residential patients, creating a new atmosphere in the nursing homes. The We Are Concerned organization's goal in part is to bring free tickets for plays, restaurants, and theaters into each nursing home for their residents. Over the past 5 years, the organization has given away many free recreational tickets to the many nursing homes throughout the Chicagoland area and suburbs. Free tickets such as Walt Disney Ice-Capade tickets, Barnum and Bailey Circus tickets, White Sox Cub ballpark tickets. The We Are Concerned organization has also sponsored annual boat cruises, annual musical concerts, and annual picnics for nursing home residential patients. The We Are Concerned organization's concern is not only for nursing home residential patients, but we're also concerned about you. And on today's show, my very special guest. He is a member of the We Are Concerned organization, and again, we bring to you Dr. John Young, back specialist. And we'd like to welcome Dr. Young and another special guest, Steve Leiker, to our show. And welcome.
Hello again.
Good to have you back.
Thank you.
Thanks.
You've received many phone calls. You know that. So today we're going to give our viewers more free knowledge to better their health. So what do you have for us today?
Well, today we were trying to demonstrate a program that's designed to help people who are already healthy maintain their health, and those that might have specific problems with their back, neck, shoulder, and knees. Simple home exercises that they might be able to do to help increase their health performance, as well as their longevity and spinal integrity and joint strength.
Does weight have anything to do with back problems?
Certainly weight does have a component in dealing with back problems. For instance, you'll notice that when a woman gets pregnant or if a man has excess baggage in the front around the belly area, that tends to put an increased stress and structure on the stomach muscles and makes the back muscles a little bit more lax, changing the gravity distribution on the body, therefore putting weight on the wrong elements of the spine. This can lead to premature arthritis and exaggerated degeneration. In addition, we find that some women who might be a little more top-heavy tend to carry their head forward, bring the shoulders forward, and as a result, it creates a lot of tension in the neck coming up to the base of the skull. In essence, creates a cycle of headaches.
Some of the viewers that have called you, basically what have a lot of complaints been about?
A lot of complaints have been, what can I do at home? Keep me away from the doctors as much as possible and try and keep some money in their pockets. What can we do at home in a short amount of time with minimal stress and sweating to rehabilitate ourselves so we can be more productive at home and on the job and with the loved ones we care, to get back into our sports hobbies like we used to do when we were 20, 25 years old.
So we're going to get right down to it with our good friend Steve Leiker. And what are you going to show us today?
Today we're going to do what I call core level training exercises. It's a program that's designed in 15 to 20 minutes 3 times a week to totally restructure your spine and your body using very slow motions, slow movements. We incorporate stretches and very well specified exercises for each body part so no injury will be incurred. Of course, if you have any specific health problems, we ask you to ask your chiropractor or sports physician. And before you begin the program, but this is geared from everybody from age 6 all the way up to 96.
Isn't it something? So, well, we're ready when you are.
Okay, let's do it.
Okay, he's going to take the mic off and you're going to keep the mic on.
That's right. And we're going to come down a little bit lower here. And first of all, what we're going to do is we find a lot of back problems are incurred when the hamstrings are very tight. So we're going to show you a simple stretch that you can do for the back of the legs. So I'm going to have my assistant, Mr. Liker, lay on the back. And you should do this on a fairly firm surface, the floor versus a water bed or a mattress. And the first thing that needs to be done is we're going to make sure that the low back is pressed into the floor as much as you can. Keep one leg bent. This takes pressure off the spine. And we're going to take the other leg and bring it up to 90 to 105 degrees. You'll notice that he brings the leg up slowly, and then bend the toes down toward the head to get maximum stretch, not only on the hamstrings, but the calves. Then we'll bring it down a little bit to relax the tension and bring it back up again. And you want to do each stretch 3 times.
3 times.
With the right leg and then with the left leg. After that has been completed.
You can talk in the camera too. I'm sure they'd love to see you.
Okay.
I think you're on camera too.
Okay. So what we will do is do the other side, of course, and you can see how easy this is. Of course, Mr. Liker is a professional athlete, so he'll go a little bit beyond what some of the normal population can do, but you want to strive for about 90 degrees. Okay. After this one, what we want to do is show you something that we can do for the gluteal, better known as the buttocks muscles. This acts as an excellent toner to tighten up the hips and the butt, as well as help stabilize the low back. What we're going to do with this one is we're going to take both knees and we're going to pull them up toward the chest. We want to feel each vertebrae in the low back be stretched out, and it's a slow and steady stretch. We don't want any jerking motions. That will tend to stretch out the ligaments a little too much, and also the erratic pull can make the muscles actually go into spasm. So we want to try to avoid that. And we'll do that 3 times, and that's very nice. Next, we're going to go back to a one-leg bent position. We're going to do something to help out the knees. This is one of my favorites because we've really seen some wonderful results with people that have had long-standing knee problems. And this is an excellent
So this is going to help the knees as well.
This is for the knees. What we want to do is see Steve here stabilizing the thigh, because we want the motion to come from the knee, not the hip. So we really want to isolate that. And it's just a back and forth motion.
So we're getting the back stronger and the knee as well.
The knee as well, because if we can get a good core foundation from the ground up, we can take care of everything that proceeds up the ladder. Okay. After we've done that one, then we're going to work on the ankles. The ankle looks very similar to the knee, but let's watch how we do that. With the ankle, we're going to move through 4 different motions. We're going to bring the toes down and inward, down and outward. We're going to move them up and inward, and then out and inward.
And this is 3 times a week, correct?
This is 3 times a week. The whole program should take no longer than 15 to 20 minutes, and I think everybody has enough time to do that, certainly if you know that it will cut down on big doctor visits and other medical bills. Okay. And of course, we do that on both sides.
Now, if they, when they come to your office, of course, they're getting it free on We Are Concerned organization television program. But how much is an office visit to get this knowledge?
Our office visit, typically,
in general,
runs between $30 to $35 a visit. If somebody's in a car accident or they've sustained some real acute trauma, we want to spend a lot of time with them, and we'll do it a little slower. So it kind of depends on the person. Okay. From that,
but they can call up We Are Concerned organization and get the free brochures.
They can get brochures.
Everything's free here. We want you to know we love you.
That's exactly right. We've had numerous people call for the exercise brochures. We just want to show you what the actual motions look like. It's a little different than seeing a static picture and a brochure. Okay. Then what I'm going to have Mr. Liker do is we're going to roll over to the side, on your side of the body. And the trick on this one is to make sure that the body's as straight as possible. We don't want to be curled forward or curled backward. And we're just going to take the leg and bring it up toward the ceiling as high as you can go, focusing on the outside of the thigh muscle. Not only is this an excellent stretch, but it also, we've seen this take about an inch off of every woman's thighs who's come in the office within
Oh,
2
really?
weeks from this simple exercise.
I need to know that one.
So this is a popular one in our office. Then from that, what we can do is take this leg and cross it in front of the other one, and we're going to work on the inside thigh of the opposite leg by bringing this one up. It's a little bit harder to do, but it really focuses on the inner thigh, which is usually a tough sticking point. Again, we're going to remember to keep the body as straight as possible, and then we want to roll over to the other side and do the same thing.
We may have to even make it convenient where we can, you know, give away some videotapes for those that are not able to tape this right now.
We can work on that. This sounds like a good idea. Okay. And this is fantastic.
Excellent. Excellent. Now, what if they're experiencing pain and all of that at this time? Well, we know no pain, no gain, but...
That's right. You just want to do this to the range of motion that's comfortable, just to the point you start to feel a little pull, a little bit of tension. The stretches are geared to loosen you up, not to traumatize you, so the next day you have to raid the medicine cabinet. Okay. The next one we're going to do is a sitting motion, and so many people do this improperly. We're going to show the way that it really should be done. You bring the soles of the feet together, and this is a stretch for the groin muscles as well as the low back. With this procedure, all we're going to do is slowly bend forward as far as you can go until you feel a little bit of tension in the low back. This one will hurt initially if you have a little bit of a disc problem, but in this sequence of the exercises that we're showing, usually things are loosened up sufficiently so you can get in and do this a little bit. Then we can also do a little stretch to the obliques to work on one side of the spine versus the other by going forward to the left. We're going to come back to the midline and then go back to the right. Notice we're just not coming from the right to the left. We always want to come back to the neutral position. What will irritate the spine is when you combine several motions together. And typically that's the type of person will be in my office when they do a combined pulling and lifting motion. So always come back to the center and then go to the other side.
Okay.
Okay. Now we're going to stand up. I've got my little cheat sheet here. Okay, we're going to do something to loosen up the shoulders. This one is called the shoulder hug. So we're going to take our arms and wrap them around and really pull till you feel the stretch. This one is very...
I feel it already.
This one is very nice for the young ladies who might have a little extra cleavage in the front to stretch out the shoulders. And then, of course, since we strive for symmetry in the body, because most problems will occur when there's an asymmetry, we want to bring the arms back as far as we can. And this works best if your thumbs are pointed down. We do a nice stretch. Notice that Steve is standing very, very straight. Some people tend to lean forward when they do it, and that's not what we're looking for in this particular exercise. Okay. From that one, what we'll do is shoulders at 90 degrees. And we're going to do rotation, internal and external rotation. This one is very useful, especially for people just about turning 45. That's when we start seeing the shoulders getting a little bit stiffer. Usually the ladies will present to have a difficulty brushing the back of their hair. This is very important because if you don't do this, it takes a lot of money and a lot of time to fix a shoulder problem, so this can prevent it before the onset. Okay, keeping the hands up, what we're going to do is work on the forearms and the elbows by twisting them in and out. And you really want to tense in each count. It looks easier than it is, so those of you following with us on TV will already notice you're starting to sweat a little bit. Then,
When does the... Go right ahead.
Go ahead. Okay, then what I want to do is at 90 degrees, now we're going to open this up to 120 degrees, and it works on other muscles that you wouldn't normally be using. So that's very nice. Okay.
The back manipulation.
Right.
When is that?
Indicated.
Yeah.
The back manipulation, well, that's a very much loaded question. Certainly, if you're having pain in the low back during these exercises that's been going on for 2 to 3 weeks and it's just not going away, then it's important to consult a physician about that. Usually back pain will go away by itself in 2 to 3 weeks. If it doesn't, that's when you know you need to contact the doctor about it.
So is that when the back manipulation comes in?
The back manipulation would come in if we can demonstrate that the disc isn't super irritated, either through an MRI imaging or some sophisticated imaging procedure. We find it very useful in a chiropractic field for people who do have stiff backs. If you just have pain in the back, we know it's from the irritation in the bone joints. And usually we'll see that with the big stomach or the weekend warrior who goes out and he's playing with his little kids. Sometimes the pain will shoot down the leg, which is a more serious condition known as sciatica. That may or may not be an indication for manipulation, and that's why we would need to know more diagnostic studies.
Yeah, so at that point.
But even that being the case, these are still safe exercises to do, and that's why they're good for everybody.
Beautiful, definitely.
And if you do these with back pain or without back pain, you can avoid serious problems and actually enhance recovery. Those who will follow this exercise program will heal twice as fast as those who don't.
And lose inches off the thighs.
And lose inches off the thighs. That's exactly right. Okay, so you see we've gradually worked our way up. What we want to do is finish off with the wrist.
Okay.
For this one, Steve will place his arms in front, and we're going to go through 4 ranges of motion with the wrist. Palms back, palms down. He's going to cross them.
Beautiful.
Inside, and they'll go out.
Beautiful.
For those who play tennis or racquetball or golf, this is an indispensable motion. Okay. And then lastly, we're going to do shoulder retraction and protraction. Basically, it's pushing the arms in front, pushing your shoulders as far forward as they'll go, and then bringing them back. This is also excellent for the shoulder to avoid the gradual tightening that goes on in middle age. Okay, that concludes the stretching portion. Now we get into my favorite part, the exercise session. We didn't get to look like this simply from stretching, so we're going to teach you some of the fundamentals that we use at the office and many rehab clinics will use as well.
Okay.
Okay, so we're going to go back onto our studio floor.
And that number for more information is area code 312, phone number 734-3800. We love you, don't we?
That's right. Okay. Many people will have a problem with the back that started in school. And in school, they taught you some exercises that we found that aren't very good for you to do. One of them is doing a double leg stretch, and Steve will show you the one exercise not to do. This will tend to aggravate the back. That's why we showed you to do it with your feet close and your knees bent. This is the proper way to do a back stretch.
Okay.
Now, likewise, when you do a sit-up, this is the proper way to do it. And Steve will lay backward with the feet again together, the knees apart, arms on the side. Now watch this technique. This makes all the difference to doing a proper sit-up. We bring the head up, tuck the chin down about 30 degrees, just so the shoulder blades will clear the floor, and bring the head back down, and that is a sit-up. When you hold your feet or you anchor them under something, you're not working the abdominals, you're working the deeper spinal muscles called the psoas, which are, if go into spasm, can mimic a disc or arthritic problem in the back. So this is fantastic. And this is for the upper abdominals. Okay.
A lot of back problems come from just not knowing how to exercise as well.
That's exactly right. Problems will occur in the body when the inside muscles are imbalanced with the outside, when the right is stronger than the left, or the top is not balanced with the bottom.
And we think we're doing exercise and getting it all healthy, and
That's exactly right. And for many years, in a couple minutes, we're going to show you some exercises which they might still actually be teaching your kids in school that actually might be tearing up their backs. And these are ones that we'll try to avoid.
this is beautiful.
Yeah, this is fun for us too. We always enjoy coming here. Okay. We're going to show a way to get rid of the love handles that we all tend to get. And we're going to do it to sit up in the same way, sitting up. Sitting up, doing an oblique twist. You notice here that I'm making him do all the hard work while I get to narrate. That's why I enjoy this so much. And all we're trying to do on this exercise, just get the shoulder blade to clear off the floor. We're not looking for any dramatic 90-degree bend in the back. And that's fantastic. Okay. Then, after we completed 3 times on each side here, and that's about all that's needed, then we're going to do neck strengthening exercises, especially important for the ladies.
Definitely.
Definitely so. When we bring, you see Steve brings the neck up, holds it, and puts it down. All the motions we do with the neck should be in 2 parts. Bring it up, stop halfway, and bring it down. This gives us the maximum stress and also the maximum joint biofeedback, which is very important too. From this, we can add a variation where Steve will bring his head and look over to the left, and back to the middle, and then down. Again, we do not want to combine motions. And we will do that to both sides. And you can see how effectively this is working the side of the neck muscles, which are very important for stabilization. Also may eradicate some types of headaches.
Oh, really?
Oh, yes.
Knowledge to better your health.
There we go. Okay. And we can't neglect the side of the body since we've done the side of the neck. So again, we're going to have Steve roll over onto his side.
How you feeling, Steve?
Pretty good. Warming up.
He's warming up for the kill. Tomorrow we go to the health club and lift pounds and pounds of weight. Okay, Steve is going to straighten out his body, relationship with the leg. This one's good for a partner or you can't anchor it underneath your couch. But what we want to do is try and keep the spine as straight as possible and just tightening up the side oblique muscles. We're going to come up toward the ceiling about 3 times. And then we're going to switch over to the other side. The reason we're only doing the stomach exercises minimally is if you do them wrong or you do it with too heavy a weight or you do this particular exercise more than 3 or 4 times, it actually creates muscle mass here that looks like you're fat even though it's muscle. So we're looking for aesthetics as well. Now hold his feet and you can come up 3 times.
So even if you don't have a back problem, this is a way to good health, good back health.
Very much so. It'll make sure that you don't have to see an orthopedist or a neurologist or a chiropractor down the road. Certainly these are fundamentals I believe ought to be taught in grammar school and worked all the way up. Then we'll complete our core exercises laying down on the stomach. And you can have a partner hold your feet for this one. This is called back extensions. If you have a back problem, the way to properly do this is the arms will be down at the side, like this, and we want to lift the chest off the ground just sufficient enough to feel muscle tension or right to the point before you feel anything that might be a little discomforting. The more advanced version, if you're in fairly decent shape, you would put your hands on your head and you come up.
Great.
If you're a super athlete and you're looking to be even more super,
that's great.
you bring the hands.
Beautiful shot too.
Bring the hands over your head. Excellent muscle definition. I take the credit for this man's body form.
Okay.
And that's fantastic.
That's beautiful.
And the trick to this is don't overarch the back. We're not looking to compress the back elements. We just want to get the muscle tension. And that's about what's necessary to rehabilitate the
But see,
back.
Steve is in good shape, you know. What about the guys that backs are in really bad shape, you know, over 30?
Over 30.
Yeah.
Like the crew and cast members on the show. Exactly.
Steve's in good shape, so.
Steve's in good shape. My story is.
So you still want the others to.
We still want
15
the others
minutes.
to do
You
this.
still want 15 minutes.
I'll tell you.
Out of the bad back person.
Out of the
Steve
bad
doesn't
back.
have a bad back. He couldn't possibly have a bad back.
Well,
he was enjoying it too much.
He does have a good time with this. In college, I was very strong. I used to pick up cars trying to impress all the young ladies.
Yeah.
As a result, I blew 2 discs and crushed 2 vertebrae in my back.
Are you serious?
Using this same program, I took this leg, which was pretty much paralyzed, and I rehabbed it to the point where, again, I can go back into the weight room and lift comfortable and even impressive weights.
You're not even limping.
I'm not even limping. Now, if I do something wrong where I'm working on particularly large patients trying to get them into Steve's shape, Then occasionally my back will go out, and I do this regime maybe twice a day, and I'm back into shape so I can be able to work for the next day.
Oh, this is great.
But these exercises are a testimonial to the body's ability to heal itself if you're given the information properly and you know what to do with it.
It's beautiful. So is that the end?
That pretty much concludes it.
Well, just have a seat and let's
Okay.
talk about some more good stuff here.
Very good indeed. In the last program, we covered a little bit about nutritional supplementation, and I think that might be important for some of the people who are hurting a little bit. My recommendations, if you do have a new injury, some new pain, and you really don't want to take a lot of aspirin, it upsets the stomach or so forth, we know that a little extra vitamin C is very useful, to the tune of about 3 to 4 grams a day. What this means is 3 to 4,000 milligrams a day dispersed throughout the day. You do not want to take that all at one time. As far as bone mass is concerned, if you have any bone problem, there is a wonderful product out called microhydroxyapatite crystals, which are basically baby cow marrow. And if you will take this, what it will do is actually decrease back and neck pain, increase bone strength, and has even been indicted to reversing some arthritic degeneration as well as spinal decay. The exercise program here is also designed to put minimal stress on the joints, which is just so important to preventing osteoarthritis, osteoporosis, and other problems which may occur down the road. So microhydrocrystalline hydroxyapatite is the preferred choice of calcium if that's a concern for you too.
It's also interesting. Now, a person that's done all of this 3 times a week, still not working, back still hurting. What's next? Surgery? Or is it something, you know, serious?
I tell them to get a divorce. No, no, but seriously, you need to get that evaluated by somebody who does specialize in musculoskeletal injury, whether you choose it to be an orthopedist, if you've got a good general practitioner that's got knowledge on that, chiropractor, a physical therapist. Just ask your neighbors. Chances are that somebody in your locality or somebody you know has had their back or spine worked on, being that 80% of the population at some point in their life is going to have a problem in their spine. We find that people who do these exercises and do them regularly, they don't have the problems as the normal population does.
Now, exercising in the health club, let's talk about the no-nos.
Okay. One of the things that we see in the health clubs, which is kind of irritating, is actually people just dressing up like Fashion Wars with the big Mr. T back belt on. Again, this should only be used if you have a pre-existing back problem, because it doesn't allow you to exercise the muscles. You don't get the full benefit of the exercises. So wearing a back belt without a back problem would not be in your best advantage. In addition, if you don't have an ankle problem, it would be rather detrimental to be wearing high tops. You need your ankles to get exercise. If you're wearing high tops, the next joint in line is the knee. You'll start wearing those out a little more than you need to.
Well, we're out of time, but we loved this, didn't we? Didn't we? How you feeling?
Good, thanks.
Good, good, and ready to go again, huh?
Feeling ready for our next session.
Well, until next time, we'd like to say we love you, and we're sending knowledge to better your health. And again, that number is area code 312, phone number 734-3800. Till next time, bye-bye.
Bye.